Well, thank you very much. Good morning and good afternoon, good evening, everybody. I'm very pleased that I could present our country this morning, and I would like you to give some insights in how we ensure maternal and child health amidst the COVID-19 pandemic in the Netherlands. Um, Please feel free to put in question and answers. Let's see. Okay, well, first, I would like to show you some numbers about the epidemic in the Netherlands. We had our first case in February 2020, and we had a first wave of diseases in the period of March and May, as you can see on the sheet. And currently we have a second wave, and again a lockdown since December until probably the 2nd of March at least, which means that schools are closed, most shops are closed, and people are working from home as long as that's possible. We are now having in total over 1 million of cases and over 15,000 deaths, which makes us like the 27th ranking worldwide. And as you can see on the graphs, the disease patients are mostly elder people, mostly from 65 and older. And the distribution of positive tests per age group is, you can see that there's also a large group of younger people who get infected, but are not are less ill than the elder people. And it does put a high strain on the health system, especially for the intensive care units. So far, the health system could manage, and there's no collapse. Also, because we had some help from, for example, a country like Germany. And we now started vaccination since January 2021. So hopefully, well, before summer, it should make things more easy. The role of the public health service is that we play a larger role in the containment of the COVID-19 crisis, containing the disease as well as possible and keep its effect on public health as limited as possible. We do this in cooperation with national organizations. There's weekly consultations between the directors of the public health service and the minister. And a big task is, of course, testing of people and contact tracing. And we have the public health service also has a role in advising on how to deal with prevention measures and its effect on public mental health. For example, how to deal with keeping the infections low at schools, at childcare, at sports clubs, etc. And the public health service has a responsibility for vaccinating everyone from 18 years and older without a medical indication, which means currently that the vaccination has started up with the people working in healthcare and elderly people from 80 years and older. And so far, we did not start yet vaccinating younger people. Well, most importantly are for now the implications for maternal and child health care. What we have seen in the last year is that for maternal health care, it means that there's less consultations with the midwife. And there was a period from April last year that there would be teleconsultations. There's less contact with partners because the women are often asked to make the visit on their own. And there's a limitation of maternity visits after birth. We've seen a switch to more online consultations and also online pregnancy classes. And what we've seen is that in April, for example, April last year, there was less options for women, but now we've seen that there's like this online webinar, there's a big improvement on how many options there are offered online. For youth healthcare services, it has meant that only for the 14 months and younger children are coming to the children welfare clinics. And for the older children, it means that there's teleconsultations or there's only consultation for the children in need of an indication because, for example, they grow less or the parents have more questions or problems. Screenings and vaccinations continue, but in the first wave last year, the vaccinations also for the younger children have been stopped for 4 weeks, but that has been picked up afterwards. And we see a big increase in the use of the Growth Guide chat service for parents. So you also see that parents turn on well, instead of going to the general practitioner or to the child welfare clinic, they also try to search online. And what we've seen in March last year is that we had a big increase on chat sessions per month with parents. The implications for the parents to be and their children are that we see that the lockdown, the schools closed and working from home is a burden for mental health of children and parents. There's more reported domestic violence and an increase of mental health problems, especially among youth. We see that now the secondary schools are still closed, and you see that the problems are increasing for this group of children. There's an expected delay in school performance for children in areas with a lower SES, also because they have already less support in homeschooling. And parents also have less opportunities because they are busy trying to make a living. That's when they also decided to open daycare centers in primary schools for more vulnerable children and for children of parents with crucial professions. So, for example, parents who work in a hospital. What they also notice is that there's less frequent consultation of general practitioners and dentists, which means that there's also underdiagnosis and delayed treatments, which means there's a patient's delay because people are afraid of going to the general practitioner because they're afraid of contacting COVID. And there's also a doctor's delay because of the lockdown. There's also decisions to scale off the normal care because they would like to have enough place on the ICU units for COVID patients. The role of our MCH Handbook is that we can serve as a trustworthy source. People in the Netherlands are really used to using the MCH Handbook, and we also have an online application, the Growth Guide app, which has a message service, and we were able to send direct messages to parents to be and help them finding valid information, also on the COVID measures. The messages were continuously updated with the latest corona measures, and the website we run, the content was enriched with specific text for parents, professionals, and young people about COVID-19. And because we've seen a big increase on the chat service, this chat service was expanded. We have an increased staff occupation to be able to help all parents, and 3 new regions joined the chat service from April 2020. Because what I forgot to say is that for the MCH Handbook, we work together with 21 youth healthcare organizations in the Netherlands. And of these 21, we now are with 11 organizations who joined this chat service for parents. For example, to give an idea of the chat service or the message service in the Growth Guide app, people would get a message which they would see on their screen when they open the app, and also get a push message, and they have an inbox where they can read all the messages. And for example, during pregnancy, we send them a message about the whooping cough vaccination, which pregnant women receive at their 22nd week of pregnancy, that it still continued because last year people were wondering if it would be still continue. We also have sent information to parents with a younger child about the baby welfare clinic, that it was still open, what they should expect, that they were asked to come with a maximum of 1 person, just to encourage them to make use of the service, and also to, as a service for the youth healthcare, to inform parents ahead of the visit. And also lately we send more messages about how to inform your child about COVID or Corona, and why we have to take certain rules and restrictions, and also how you can cope with your teen, for example, how you can help him with this to keep a good mental health. The Growth Guide mobile application message service provides opportunities for reaching parents to be with tailored and topical information. It's a big strength of having an online application in addition to the booklet. And what we've seen is that the digitalization of youth healthcare services appears to be accelerating due to the COVID pandemic. And it's increasing the demand for the Growth Guide application and also for the chat services. And this gives also opportunities for the Growth Guide, because scaling up means that there will be more budget and also more possibilities for improving the app. and also, for example, to connect with e-health modules and improving the chat services. So besides that, COVID is a burden for the health system and the country, we also see opportunities that people could make better use of the valid information that's available for them. Thank you very much. And if you have any questions, feel free to ask.